Psychiatric symptoms have become increasingly common in individuals who have survived COVID-19. An Oxford University study examined the medical records of 200,000 COVID survivors and found that 13% of the patients have been diagnosed with a psychiatric or neurological condition within 6 months of contracting COVID. Medical experts have theorized that COVID is capable of causing brain inflammation due to an autoimmune reaction that can ultimately result in psychosis. It is believed that COVID may create deficiencies in the brain's blood barrier, potentially exposing the brain to immune cells that can be harmful to the brain cells. Joining us to discuss all this and what it means is BNC Chief Medical Editor, Dr. Corey Hébert. I was about to say something else. Dr. Corey Hébert. Dr. Hébert, what is going on? I mean, when I read this, or when I heard about this earlier today, I just thought, like, that's huge. If this thing is tampering with the blood-brain barrier, which keeps a lot of very dangerous things that in our bodies out of our brains, that's enormous news. What do you make of this?
This is a really serious situation, Charles. And the reason why is because we have known since the beginning of COVID, we're talking 19 months ago, that this whole long COVID thing is it's got several things going on here. And one of them is this microinfarct. Another thing is this microinflammation. And what tends to happen is that when you have these neurologic deficits because of all of this microinflammation, then you start having neurologic deficits, and that would mean that you start having problems with the brain, right? You start having problems when people try to move. You start having problems with neuropathic pain, all these things. But what we also found in some of these studies is that about 30% of people that have had long COVID or have been in the hospital for over 3 to 4 months have dementia. So once you start looking at the dementia part of this and having this as an outcome of COVID infection, it is going to be a major issue, because when you start moving forward, looking 2 and 3 years down the line, a lot of people that really had COVID but didn't even know that they had it, they're going to start having these neurologic problems. And once that happens, it is going to open up a floodgate of people that really need care, whether it's psychiatric care, neurologic care, or sometimes we have vascular care, because the microvascular issues with COVID is an issue. And I hate to be, this way, but we had a study to come out from University of Utah with these folks in Italy that started seeing that the men that had COVID-19 had erectile dysfunction. That's also a microinfarct situation because of the blood flow. So when you start talking about all this stuff, you are going to have a pure discipline, a whole another residency, a whole other discipline of medicine to treat neurologic problems from people that got COVID-19 and what is going to happen to them beyond. And this is groundbreaking stuff.
And what is so kind of hard to get your head around and so profound about this is that there are some scientists who believe that because we can't shake it, eventually we will all have had COVID. Like, it's going to be around for so long that eventually it's just going to cycle through. As best we can try to prevent it, it's just going to cycle through the population. And so if you just think about 13% of the population the size of the United States, let alone the world, having a neurological problem from having had this thing, the number itself is just enormous. And how do we deal with that medically? Do we even have the medical kind of capability to deal with 13% of just the population of the United States if we eventually all have COVID at some point?
Yeah, well, I'll give you a prime example. When I started internship, we didn't have a group of doctors that were taking care of adult congenital heart disease, because the people that had heart disease at birth never grew up, because they didn't have the surgeries to actually make them grow up. Now we had to do a whole new discipline of medicine called adult congenital heart disease, because we have a group of people that we never had to deal with before. So that's the same thing that's going to happen with COVID. You're going to have a whole group of doctors that are trained just to deal with these 13% of the population of the United States that are going to have these symptoms. And I think it's going to be more than 13%. And also, everybody's going to have had COVID or exposed to COVID at some point. That is pure fact. There's no way around that. So that means that you could have had it, never knew you had it, and then 3 years from now start having some neuropathic pain or start having some dementia, and then we go back, look at your antibodies and see that you actually had COVID-19, and this is probably the cause. So that's why wash up, mask up, separate, and vaccinate. That's why you do not want to get this. Because even if you get it, you may do okay, or you may not. And that's why you have to prevent this at all costs. That's why when you're over your Thanksgiving table, when you're over your Christmas table and you're eating, one thing I want you to ask is ask if everybody black there knows their sickle trait status. Because like I told you, black people can die, 4 million black people can die in this country from just having sickle cell trait and just drop dead. So that's one thing you need to talk about. The other thing you need to talk about is who's getting vaccinated, when they're getting vaccinated, and who is going to step away from that table so that they're not going to infect someone that is immunocompromised, like the colon polyp situation. Imagine if there was a person that hadn't been diagnosed with multiple myeloma yet, and then you're sitting at the dinner table with them and you spread COVID-19 to them and they die. I mean, so this is where this is very serious as we come to the holiday season.
So let me ask one other question about long COVID, meaning
Sure.
So many people who are having it are having a hard time getting insurance companies to cover it and pay for it. They're getting a hard time to find this coverage. Is the insurance industry going to have to evolve basically around COVID, right? That this will be a real feature of what it being insured in the future will look like?
Yes, but because of the sheer numbers, the insurance companies will try to get around it, but there's no way that they won't be. They will have to address this very clearly because there's going to be so many people that if they decided they didn't want to do it, or you had a pre-existing illness or whatever, it won't fly. This will go to the government and will actually be voted upon in Congress if the insurance companies decide that they don't want to deal with long COVID. That's just the bottom line. And there's enough people that are represented by people in Congress and Senate that the insurance companies will have to roll over because they want to make money. So they got to do it.
Dr. Corey Hébert, and if you're at Dr. Corey Hébert's table for Thanksgiving and you are not vaccinated, he is going to get his mac and cheese and wrap it in foil and go sit in the car because he is not going to eat with you. So, Dr. Corey Hébert, thank you so much for joining me today. I really appreciate it.